My name is Dr. Johnson Mwangi, and I am a Christian by calling and a dentist by profession. Very passionate about dentistry and chairside dentistry at that. That is being with my patient right at the chairside and just making a difference in the community by improving the dental care and welfare of the people in the community at large. I am a husband and a father of 3. I started off as a dentist. Of course, went to dental school at the University of Nairobi and graduated with a Bachelor of Dental Surgery in June 1991. So that's where my journey as a dentist really began after graduation from the University of Nairobi. Yes. After graduating from dental school, the Bachelor of Dental Surgery in 1991, over the last 25 years, I have gotten quite a bit of postgraduate qualifications in form of I have a master's degree in an MBA from the University of Nairobi, specializing in strategy and practice development and all that. I have a postgraduate diploma in oral implantology from the University of Pretoria in South Africa and New York University in the US. And I've gotten a certification in cosmetic dentistry and also in orthodontics. So these are areas that I've gotten postgraduate certification in, and these are the areas that I'm basically practicing as a dentist here at Tender Care Dental. Well, I think Kenyatta National Hospital, that was really where we started off. After graduation, we were automatically absorbed by the government and went for another 1 year of training as an internship. And I did my 1 year of internship at Kenyatta National Hospital, and that time things used to work and function. So it was a very good experience rotating in all these departments at Kenyatta National Hospital and doing my basic training there with all these consultants. That's where my journey began. I didn't start off in private practice immediately after that. After graduating from dental school in 1991, I did my internship at Kenyatta National Hospital, as I've said, for 1 year. And then after that, I resigned from the government and joined Kijabi Mission Hospital. That time it was called Kijabi Medical Center, and as a dentist, and in the position of Deputy Director of Dental Services. It was a very big position. Americans are very generous with titles. And I joined a team of American dentists there. 2 dentists there, Dr. Warren Rich, who was a general dentist, and Dr. Jim McDonald, who was a retired orthodontist. So I worked with them for 3.5 to 4 years before venturing into private practice. I think it would be good to mention that I gained a lot of experience by working under these 2 mentors. They are the ones who mentored me very early in my career. And probably what I am today, I would give it to, especially to Dr. Warren Rich, who mentored me professionally and all areas of life and encouraged me to practice ethical dentistry, to be compassionate with my patients, and to increase my clinical skills by going for courses and all that. And so that's where my journey began. And then in April 1996, that's when I actually started my first private practice and Thika Dental Care Center in Thika town. And started very small, and then from there started growing. Yes. Thika Dental Care Center, we started it in 1996, and it grew quite fast. Within about 3 to 4 years, we had really expanded and hired an extra dentist to help with the work. And I worked there for whole 12 years and grew the practice. Arguably, by the time I left, Thika Dental Care Center was probably the biggest dental practice in central Kenya and the Mount Kenya region. Yes, and when it was at the height of that, that's when I felt now it's need, I think, to expand more. And that's when we moved into Nairobi in 2008 and started Tender Care Dental. Started from scratch again. I think in life, after some time, there's always need to kind of like reinvent yourself again and start afresh again. Though I didn't close Thika Dental Care Center, continue to run it, but I came into Nairobi and started Tender Care Dental. Yes. Tender Care Dental opened its doors in 2008 as a 2-surgery practice, and myself being the only dentist. Took a little bit of time to pick up, but I think within 2 years we had picked very well. And within about 3 to 4 years, we actually doubled our surgeries from 2 surgeries to 4 surgeries, and therefore there was a need to hire extra dentists. So that's when we hired another full-time dentist plus 2 other part-time dentists to work with us. So right now we literally doubled both the number of surgeries and even the number of dentists and the number of staff that are working for us. Right now we have on average about a staff of 12 working for Tender Care Dental. Yes, we consider community service, CSR, what people call CSR, is a very important thing here at Tender Care Dental, because we feel that for every organization there is a need to give back to the community. And how do we give back to the community? I think the easiest way is to use what you're trained in, your area of specialization and profession. I think that's a much easier way to give back to the community. So in this, I have done a lot of many dental camps around the country, especially in Masai Land. I think that's where I've really spent a lot of time over the years giving back to the community there. The other one that we did in a very formal way was to start a clinic, a dental practice in my own village. And in that clinic, we offer basically all the general services that are done, cleanings, extractions, fillings, and all that. And we give this to the community at almost below, we call it below price, okay, to the and as a gift, as a gift back to the community. That way, we are able to give back what we've learned and what we acquired. So actually, we support that clinic from our Nairobi office, and I think that's a very important thing for us to do. Yes. My vision for Tender Care. I think my vision started a long time ago, and it was to be the best care provider for dental services in the country. Mm-hmm. And over the years, I think we have really met this goal. We can confidently say that Tender Care is probably one of the best dental practices in Kenya, or probably in the region. And I think we have gone beyond that, in that right now we are seeing not just clients from Kenya, but we are seeing many other clients from across the globe. As it is now, right now we have a clientele from around 68 to 70 nationalities who are being seen at Tender Care Dental. So I think that's really something. The other goal for us here is to train young dentists. Over the last 15 years or so, 20 years that have been in practice, I have actually trained very many young dentists, mentored them, They come into tender care, work for us for 2 to 3 years, and then from there, we set them free to either open their practices or go for postgraduate training. And I think I continue to that, and I will continue to mentor young dentists and just give them a solid foundation as they start their career, and then set them free to start their own practice. That way, I will have implicated myself in the community and in the society, and I think my legacy as a dentist can go beyond myself. For Tender Care Dental, we plan still to grow. We look forward to probably opening a second and probably even a third branch within Nairobi in the next couple of years.